Good afternoon. I'm with Dr.M.S.Sandhu. He's Principal Director and Head of Cardiology Department with Fortis Hospital. Dr. साहब, we just wanted to know कि कई बारी लोगों को हार्ट अटैक हो जाता है तो उस टाइम पता ही नहीं लगता, लोग सोचते हैं कि गैस्ट्रिक प्रॉब्लम है, अजवाइन ले लीजिए या डाइजीन ले लीजिए उस तरह से। तो आपके हिसाब से क्या सिम्टम्स होते हैं जो जब हार्ट अटैक हुआ तो लोगों को पता ही नहीं लगता, क्या बेसिकली सिम्टम्स होते हैं?
मेजॉरिटी ऑफ द टाइम्स जब हार्ट अटैक होता है
जी
तो क्लासिकल चेस्ट पेन होता है
जी
एंड विच कैन गो इनटू द लेफ्ट और बोथ द आर्म्स
राइट
और बैक में भी जा सकता है associated with sweating and the pain is like constricting pain, you know, like this. And तो ये क्लासिकल होता है. But sometimes heart has got three arteries, two on the left side, one on the right.
Okay.
The right artery supplies the bottom side of the heart.
Okay.
And when that heart attack happens of the right artery, then symptoms may be like gas
Okay.
because it is next to the stomach. So you start having burning and burping,
Okay.
and so a lot of people at that time think that it is gas.
Right.
So, but one should remember that gas. Why should it start suddenly?
Right.
If you are having acidity, you should be having it every day.
Right.
You know, and you must be having to pop some kind of pills or the other. Right? So that doesn't, if it starts suddenly, this gas problem without any rhyme or reason, that means it's something to do with the heart and one should not take a chance.
Okay.
Even if it turns out to be gas, one should go to the hospital, get their ECG done and see a doctor, and maybe if it is actually gas, it will be normal and then they can come back.
Right.
But one should not take a chance.
Okay. And some people talk about silent attack and all that, those people who have the diabetes and all that. What exactly is that silent attack?
See, long-standing diabetes over time damages the nerves which carry the sensation of pain from the heart.
Okay.
So when those nerves get damaged, typically more than 15-20 years of diabetes.
Right.
So whenever such patients also do not have angina on walking, chest pain like normal people, they just have breathlessness or tiredness.
Right.
So in these people, if there's a heart attack, the pain sensation may not come. There may be just sudden episode of sweating or burping or some weakness, and they pass it off as something.
Right.
But actually, that's a heart attack which has happened. So around 20% of all heart attacks can be silent.
Right. So what normally one should do? Suppose we come to the conclusion that at home that you have a heart attack. So what should they take any medicine? Like earlier they used to say sorbitrate.
No, sorbitrate is not the right thing because it causes drop in blood pressure and it's a painkiller.
Okay.
We don't want to, by killing the pain or reducing the pain, we are not stopping the attack.
Right.
So best thing is to do is to, if you have aspirin at home,
okay.
So one whole tablet of aspirin dissolved in a glass of water, you
Right.
should immediately take.
Okay.
And ideally, if you have some cholesterol medicine at that time, so a high dose of cholesterol medicine also can be taken.
10 mg, 20 mg?
40
mg.
40 mg of rosuvastatin or 80 mg of atorvastatin.
Okay.
You can take along with aspirin and then rush to the hospital.
Okay.
These two things can alone aspirin alone given at the right time causes reduction in 33% in mortality.
Okay.
So aspirin and a high dose rosuvastatin should be taken and then rush to the hospital.
Okay. And any other precaution till the time you rush to the hospital, like lying down, or you should not?
No, you should not exert.
Okay.
You should be comfortable lying down. You should not be ideally if there's we have an ambulance this thing, so one should be in the wheelchair and then going to the ambulance, etc. Not to exert at all.
Right.
Yeah.
So once you reach in the hospital, then of course.
After that, immediately they will diagnose and other
Right.
angioplasties will be done.
Right.
Yeah.
What other do you think measures one should take? I mean, apart from heart attack, suppose a normal person is there. What precaution they should take, and after what age they should get some tests done and all that, so that they don't have heart attacks?
See, ideally after the age of 40, because the average age of people getting heart attack is coming down and down.
Right.
So I think after the age of 40, every year one should do a health checkup.
Okay.
And if you have got blood pressure, diabetes, high cholesterol, which comes out during these tests, so one should make sure that they are well controlled. Your blood pressure is absolutely well controlled, sugar is absolutely well controlled, cholesterol levels are in check. So that, and you should have a healthy lifestyle, that is eat healthy, daily exercise, very important, active life. So all these things one should do as precautions to prevent heart disease from happening.
Right. Normally, the people say that there are so many factors which affect the health of the body and leads to heart attack and all that. One is hereditary also. So, any specific test to be done for hereditary?
No, in patients who have got a family history, strong family history of heart disease, like grandfather had, father had, elder brother had.
Right.
So in these patients, even if they are absolutely normal now,
Okay.
after a complete check,
Right.
we treat them as if they have got a heart problem.
Okay.
So the levels of cholesterol and BP and sugar become more stricter for them,
Okay.
because that is one thing which we cannot fight against, the genetics. It's like written in your genes that you will have heart disease.
Right.
So we, what I follow is to treat them on level with existing heart patients, like your cholesterol, LDL, bad cholesterol. We target it to be around 100 for normal patients, 100 to 130.
Right.
For a heart patient, we target around 70. And the same target is for a patient who doesn't have any heart problem but has strong family history.
Okay. So those
To make sure that whatever we can do.
But normally in due course, apart from doing that blood test and other things also, do you recommend, suggest we should get done ECG and other things also, or not?
No,
not required.
if you are above 40, 45 years of age, we do a stress echo.
Okay.
That tells us the right thing. A lot of people do ECG. ECG is of no value,
Okay.
because ECG is a snapshot at one given point of time.
Right.
So it's not going to convey any information unless you are having pain. Then it will tell me whether you are having a heart attack or not.
Right.
But routine ECG when you are asymptomatic is of no value.
Okay.
So stress echo is better, in which we stress the patient and see. And if that is normal, that means we have by and large excluded any blockages.
Okay. Stress echo you recommend for normal person also after 45, or if anyone
No,
has
I think normal people also.
Okay. Okay. And how frequently it should be, once in a year or twice in a year or something?
Once you can do it 45, then every third year till the above 50.
Okay.
And then after 50, I think we should do it every year
Okay.
for men.
Right. So any other thing you want people should take care so that it does not lead
I think people should be happy.
Okay. That's more
Because
important.
stress is a big factor for heart disease.
Yes.
So I feel people should be more happy and relaxed.
Right.
That way they will have less heart disease.
Right. Thank you so much, Dr. Sir,
Thank
for
you.
your expert opinion and giving us your valuable time.
Thank
you
you.
so much. Thank you. Bye.